I think it takes two or three things. I think, first of all, it takes the realisation that that coming up to about 10% of the economy, that health services form a very large part of economic well-being in New Zealand. If we are going to continue to grow and develop as a well-developed economy, we have to make sure that we innovate in healthcare. It's the only way, I think, that we're going to continually to improve services and standards for patients. So it's a core aspect of what we're doing. The second reason is, I think, about leadership. Now, I'm not talking about me, I'm actually talking about the leadership of the organisation, which is many people who hold the value of that, or the values of the organisation very strongly, the doctors, the nurses, the senior managers. It's all about saying, how can we use our collective experiences, our collective abilities, insights, initiative, in order to say, how do we actually develop and improve the organisation? And the third thing, it is to collectively create a culture where actually innovation is what you do. Mm-hmm. It's not an added extra, it's not something that happens accidentally, but that you have the power and responsibility to innovate. The entire strategy of our District Health Board can be summed up in 4 words. It's passing the granny test. We have to make sure that everything that we do is good enough for a member of our family to receive. And if it isn't, each one of us have the power and responsibility to innovate to make sure that we do. Innovation for us is about core business. I think there's lots of existing technologies that we ought to begin to converge together to help support and keep people particularly out in the community. We can do lots of things around remote monitoring with technology that already exists. That would mean to say that we can provide high-tech healthcare, which, for example, may be only available in the cities, way out into the rural environment. It means to say that if we bring certain technologies together, people won't have to come to hospital at all to be treated. If we use existing technologies, we can teach and train surgeons, for example, to be able to undertake the latest types of surgery using technology that already exists in order to improve their training. But also it means, I think, being creative with the use of technology. It means actually, first of all, defining what the problem is. Being very clear what it is that we're trying to achieve, and then saying, okay, if we're going to achieve this, what technology do we have to develop, innovate, bring together that help us solve this problem? I think the interesting thing is that way back in the late 70s and early 80s, in America and Canada, they discovered that using nurses, for example, to do endoscopies was safer because they do it all the time, that the staff were more stable because they stay with you longer, that they were more cost effective, much more productive because that's what they do all the time. Now, 30 years ago, the Americans and Canadians worked out that developing roles like that, unlike others like anaesthetic nurses, for example, were able to ensure that we can sustain and develop a broader range of health services. Whereas in New Zealand at the moment, we don't have any nurse endoscopists. And I think we need to get ourselves into a frame of mind where we are able to take the evidence of what other people have done, to adapt them for our own circumstances, and make sure that in the context of our own country and own economy, that we can provide an ever-broadening range of services. It's going to be really tough and difficult for us to do a proper bowel screening program, and bowel cancer is the 3rd most fatal cancer that we have in New Zealand. It'd be really difficult for us to have that program without developing new roles for nurses, for example, to do endoscopies. And that to me is a really important issue about how do we actually begin to address some major causes and disease in this country. It's also about not locking out really great, capable people out of careers, services that they could provide by old thinking and by defensive, protective thinking. I think the time has gone for that.